So hello and welcome. Thank you for joining us. We're excited to have you here for the webinar, Virtual Assessment in Early Intervention and Early Childhood Special Education, Why to Do It and How to Do It Well. I am Sheresa Blanchard, Project Director for the Innovative Technology for Early Childhood Assessment, or INTECA project, and I am based in North Carolina, and with me is...
Hi, everyone. I'm Kathy Hebbeler, and I'm the principal investigator working with Sheresa on the project.
And we also have our project officer from the Office of Special Education Programs with us, who will also introduce herself. Rebecca, go ahead. You can unmute and you can turn on your camera if you'd like.
Hi, this is Rebecca. I'm not sure if I don't have the camera option, but I welcome everybody. And thank you on behalf of the Office of Special Education Programs for being here. This is a project that was a whirlwind for three years of fantastic work, culminating in resources that we hope will continue to be used for many, many years to come. So I'm glad you're here, and please spread the word.
Thank you, Rebecca. Now we would like to know more about you, those attending the webinar with us today. In the chat, please share your name, your role, and where you're located. We're grateful to have you with us today. So on the next slide, you'll just see some things we'd like you to share in the chat. Let me open the chat so I can see that. All right, let's see. Georgia represented and OSAP. North Carolina. Mississippi. All right. So folks adding. All right, feel free to continue adding in the chat as we move forward. So for our time together today, you will get a bit of background information about the INTECA project. We will review INTECA resources and we'll cover what we learned about virtual assessment throughout the project. We will also share about the INTECA framework and include a few lessons learned from our state and local early intervention, early childhood special education partners who you'll hear from later. As we share the framework, we will highlight information about virtual assessment, including resources we created to support states and programs with virtual assessment, including decisions, things about adopting virtual assessment and implementing. And one additional note before we continue, please add questions in the Q&A section throughout our time today. And we'll have time for questions. We'll try to keep up with those throughout our time, and we'll have time toward the end of our webinar as well. So what is the INTECA project? As I mentioned earlier, INTECA stands for Innovative Technology for Early Childhood Assessment. It's a 3-year project, as Rebecca mentioned, funded by the Office of Special Education Programs. And on the next slide, you'll see that our project has had 4 main objectives. First, to learn more about the facilitators, barriers, and other information related to using technology for authentic assessment for young children. Also, to develop a framework to support states and local programs as they make decisions about virtual assessment. Another one of our objectives was to develop resources to support the framework and also support states and programs, and then to share the framework and resources as we're doing today. So throughout our project, we've been interested in all types of all purposes for assessment. Though we heard a lot about eligibility, we're also focused on technology use and assessment for monitoring progress, child outcomes, and planning. On the next slide, you'll see that we have 4 main activities with our project, and there was a lot of time and effort bundled into each one of these activities. We interviewed state coordinators, local program staff, and family members about their experience with virtual assessment. We also reviewed the literature, looking more closely at articles on telehealth, virtual assessment practices, and lessons learned about virtual assessment. We reviewed professional organizations for their guidance on virtual assessment and telehealth, including American Speech, Language and Hearing Association, or ASHA, the Division for Early Childhood of the Council for Exceptional Children, or DEC, and many other organizations. And we've developed resources and a framework to support decision-making and implementation. So today you'll hear more about our framework and resources, but you'll also hear from some people we interviewed to inform our products we developed. I mentioned the interviews we conducted on the last slide, but we spoke to 79 people through interviews and focus groups. For our focus groups, those were staff that were within the same program that we interviewed together. When we interviewed them, we included state administrators, local administrators, we included practitioners, some of those who were primarily conducting evaluations in their role, and we also interviewed family members. Our interviewees hailed from 11 states in the District of Columbia that you'll see represented in this map, and they represented a full age range from birth to age 3 and 3 to 5-year-old programs. For the interviews and focus groups, we asked about technology they were using to support assessment. So when we focused on that, we were more specifically thinking about virtual assessment and when they were using virtual assessment, and also why and how. We wanted to know more things about the benefits and challenges programs were facing. We also wanted to know what they were doing to support virtual assessment and how they were addressing any challenges that they might be facing. We asked things about policies that they have in place at the state level and local level. We wanted to get perspectives about the quality of virtual assessment. And we also asked families and staff how they felt about virtual assessment. We then took the transcripts from those interviews and focus groups and coded them. And we focused on those key themes as we developed our resources and framework. One thing that we learned was that many programs started using virtual assessment due to COVID, limiting the ability for in-person contact. But we also learned that some programs started using virtual assessment before COVID or after COVID, and that those that continue have made changes along the way. So now we will turn it over to Kathy, who will share more about the INTECA framework.
Thanks, Sheresa. And thank all of you for being with us today. I'm going to talk about the framework, and the framework it is most geared to local programs and local program directors, but it's also useful at the state level. It's useful for anyone who wants to learn more, think more about virtual assessment. And it encompasses what we learned through all the interviewing process that Sheresa just described. We're going to walk you through the steps of the framework, so I won't talk much about those. But within each of the steps, there are 5 areas: leadership, practitioners, families, technology, policies. And I'm going to go into a little later as to kind of what each of those mean. But each of those circles applies to each of the steps. So let's start with the next slide and step 1. So if you are a program or you are a practitioner thinking about talking to your program director about adopting virtual assessment, what's the first thing you need to do? The first thing you need to do is understand what virtual assessment is and why your program might want to use it. Next slide. So what is virtual assessment? Hopefully, most of you here have some understanding of it, which is why you even clicked on and registered for the webinar. But this is the definition that we have been using throughout our resources. A virtual assessment is where one or more of the assessors is not physically present where the child is being assessed. They're using video conferencing to collect information about what the child knows and can do, as opposed to being in the room with the child. Virtual assessment also can be hybrid, and that means that there is one person in the room, one member of the assessment teams in the room, and another is not in the room. Another variation on that is that some of the assessment takes place virtually, some of it takes place before or after that in person with the child and the family. So there are variations on the hybrid theme. One of the things we want to be clear about is all of our work, including the framework, addresses virtual authentic assessment. And authentic assessment is when the child is being observed in a familiar setting, engaging in natural routines, natural everyday routines. It's important to understand that because virtual assessment, one, is recommended practice with young children, but also that very structured, standardized direct assessments don't lend themselves very well to virtual assessment. That's not to say that people aren't trying it, haven't tried it, but we are focusing on authentic assessment where the child is engaging in everyday activities. Okay, next slide. One of the things we want to do for you is spotlight some of the resources we have. This is a very short little document, but it's considerations for using virtual assessment for different assessment purposes. There's some things that are very similar, regardless of whether it's screening, regardless whether you're planning for transition, you're monitoring progress. And there are a couple little things that are a little bit different. And so what this little document points out is some of the differences, whether you're using virtual assessment for screening as opposed to monitoring progress and ongoing planning. And I think Sheresa's putting the links in the chat for you. All of these are also on the website, so they're very easy to find. Okay, let's talk about some more resources. This one is our professional scan, and Sheresa mentioned earlier, this was one of our charges. This is a web page as well as a document that contains links to the various professions that provide early intervention and early childhood special ed services. So if you are an SLP and you want to know what ASHA has to say about virtual assessment, you can go to our web page, find the link where in ASHA they're talking about, and much of this is telepractice and virtual assessment, and sometimes it's just telepractice in general. One of the reasons we did the scan is that we were hearing during our interviews that from various professions, people who thought that their professional standards would not allow them to do this. There are differences in licensing by state, but none of the professional organizations say anything negative about virtual assessment. So there's no prohibition nationally from any of the organizations. Next slide. This is just a cute little one-pager. If you want to know more about authentic assessment, you can look at it and kind of get some of the key features about what authentic assessment is. And it has a companion document, which is the next slide, which is a checklist. If you are wondering whether your program is doing virtual assessment, work through the checklist. And again, part of what we want to say here is if you're not doing authentic assessment, please consider updating, changing your assessment practices to incorporate much, if not all, authentic assessment into your practices. And we have one more. This is part of the understanding. We have a very short overview video of what virtual assessment is and how it's being used in early intervention and early childhood special ed. We are editing it right now. It's not quite finished, but it is coming very soon to our website. Okay, and Sheresa, I think I'm turning it back over to you.
Yes, Kathy. All right, so now that we have a foundational information about like step one and understanding virtual assessment, we're heading into step two, which is deciding to implement virtual assessment. One of the things to think about when you're deciding is the benefits and challenges. And so, to help us understand benefits and challenges based on their experience with virtual assessment, we have three guests with us. Our guests will introduce themselves and then they'll respond to a few questions. And so we'll just get started with them introducing themselves now.
Hi, everybody. I'm Amanda Thompson. I'm a teacher for the blind and vision impaired, an orientation and mobility specialist, and an AT specialist. I live in Virginia and work for Allied Instructional Services, and we're a nationwide organization. We provide a lot of remote assessment and services.
Hello, I'm Becky Heyman. I am the System Point of Entry Director for Indiana's First Steps Early Intervention Program. We have 25 of the 92 counties in Indiana that we are responsible for, providing both assessment and service coordination.
And good afternoon, everyone. I'm Dawn Meskel, and I am the IDEA Preschool Coordinator with North Carolina, and I work within the Department of Public Instruction.
Great. So thank you. Welcome to all of you. So our first question is just for all of you. Can you share some of the benefits you have seen with virtual assessment in your program or state?
I can go. As a practitioner, I can tell you that we are able to get assessments to students and children who otherwise wouldn't have someone there. So I'm a teacher of the visually impaired. We are very specialized, and there aren't a lot of us. And so there are many situations where in EI programs, kids weren't getting any services or support, and we're able to do that because we are remote.
Amanda, so increasing access. Go ahead.
We began doing virtual assessments during COVID. And then after COVID, we made the decision that we wanted to continue that. We felt that there were several benefits that we saw to providing our assessments and evaluations for eligibility determination. It really enhanced the capacity of our assessment team contractors. Therapists and contractors weren't bound by geographical bounds. In Indiana, we have some very rural communities where it takes 2.5, 3 hours to get there. And so when we were doing virtual assessments, that went away, which then allowed us to pretty much schedule consistently 4 to 5 evaluations a day, where before it may have only been 2 because travel time was such an amount of it was such a the need for travel time. It also gave us the ability to offer some later appointments for families that work. And that wasn't always the case because our contractors have their own families. And so asking somebody to work after 4 o'clock or after, 2:30 when they had to drive 2 hours wasn't really conducive to having those late appointments. And then virtually we found that we could offer those to families. We felt like families got their assessments timelier. Obviously, we were looking at the 45 days, the federal indicator, but we also felt like by doing them and having the ability to offer more assessments in a day, not being in a boundary where we had a provider that was only maybe in that county twice a month. And if you happen to come in after that twice a month, you had to wait till the next month. So that was, affecting the 45 days. We also can offer more discipline-specific teams now. So if we have families or children that had specific medical diagnoses or concerns, and we've even kind of started addressing like the licensure. So we're seeing that more of our provider network agencies are hiring CODAs and PTAs. PTAs require that supervisory, and so if we can have a PTA on the assessment team, we've already got that before the child even starts services, so we felt like that was a benefit. We also can switch teams a little easier virtually. So If a team member had a crisis, sick child, an emergency, we now have the ability to put out a, hey, anybody can do this 3 o'clock eval, and then have it done so we're not having to reschedule families or switch evaluation appointments for families. We also can work, or our schedulers can also work with when we do have cancellations or no-shows. We can try to get those filled quicker. You can't do that when somebody's out in the field and you're like, well, could you drive another 45 minutes to see somebody? So we felt like that was also a benefit. And then we're starting to see multi-family members join the assessment. So if the dad is having to be at work and mom's at home, he can jump on during his lunchtime or whenever, and also be part of that, where sometimes we would have to schedule those at times when everybody was there. Now we're having the ability to do that. We're also seeing the ability to use that with some of our DCS referrals, so that we can have both the foster placement as well as the biological family in those initial assessments, which then, kind of helps with that reunification process. And then also, this will be a good study. This will be your next study, Sherese, is if we are able to get that started that early, are we seeing families that once their reunification has been completed, are they staying in the system? Are they, vested in early intervention and able to continue that because they started at the very beginning and heard that? So we felt there were a number of benefits to doing that. And so we continue. I would say probably we do about 85% of ours virtually. We do offer in person if families request that, but the majority of those are done virtually.
Great. Thanks, Becky. You shared a lot of great information. And one thing you shared, excuse me, about a parent or someone that's not in the same location being able to join, we also heard that with family members that may live far away, being able to join grandparents, aunts, uncles, things like that. And just to clarify, when you said PTA, physical therapy assistant, and there may be other things. So continue to put, I see there's one question we'll get to in a bit, but continue to put questions in the chat as you have them. I mean, in the question and answer tab. Go ahead, Dawn.
Yeah, I'll just add briefly. I think I'd second everything that Amanda and Becky shared. And for us too, you mentioned COVID. I would say definitely a benefit was that staff were more efficient and comfortable during COVID, whether that be completely remote or some of that, the hybrid options that Kathy mentioned. We found too, we heard from our school districts that they were noticing they were collecting more authentic assessment data because their teams were able to better leverage the family's expertise and engagement in those more natural environments. And then they were able to observe children in more familiar and natural environments. And so they noticed that as kind of a like, wait, we didn't think this could be better, but we might actually be getting better data this way. They also found a benefit was really engaging families in designing certain aspects of the experience. So similar to what Becky said with potentially getting family members from other places or who couldn't be present, really getting families involved in deciding, what kind of equipment can we use? What are we going to capture and how are we going to capture it? Who's going to be present? Who's going to be virtual? Just things like that really helped engage families and partner with them right from the beginning and leverage them as experts. So those are just some of the benefits specific to families and children that we saw.
Can I add
Go
one
ahead,
more
Amanda.
that you
Yes,
just,
I was going to
both
say, you
Becky
want to
and
add
Dawn
anything else?
reminded
Go
me of,
ahead.
and that is, I feel like we get a lot more collaboration for our internal team because a lot of our assessments have one of us in person and are hybrid. And so we get to see their specialty and expertise in play, and they get to see ours too. And then there's a lot of carryover of that beyond when we're just doing that assessment together.
That are able to collaborate with some being in person. Okay, thanks, Amanda. Did anyone else think of anything else you'd like to add about benefits for families or practitioners? Keep thinking. You can add more to that if you'd like. So what about challenges? Are there challenges you would like to share and any solutions you found along the way?
I think that a couple of challenges are, Again, Indiana can be pretty rural. And so just the internet connections, we have some families, believe it or not, still don't have that. And it's kind of difficult for them to participate in that. So I think that was definitely a challenge. We tried to do some things, like we did offer like a loaner program to help with that. Like if the family, if the barrier was, hey, I don't have a device that we could use, we did develop like a loaner program so that we could take like a laptop or an iPad to families after it had been swiped and cleaned and what have you. So I mean, it was a challenge. I think the challenge sometimes still is, even when it's virtual, we'd have families that would no show or cancel like at the last minute. And then trying to work to get those slots filled for our contractors, so that they did have a full day. I mean, that's what we have, some that only work maybe one day a week. And so that's their income. And so having those 4 to 5 are important for them. And so I think that's a challenge sometimes, is making sure we have that component. So yeah, I think those are a couple challenges that we've seen.
Thank you. Go ahead, Tom.
Yeah, I can share a couple as well. And I'll say again, related to COVID, I think that was our first big opportunity to dip our toes in the virtual assessment arena. And so, unfortunately, I don't think that the early childhood field was really prepared for virtual assessments or trying something new at a really stressful time. So that kind of hindered just our efforts. We had to kind of take some time to learn and gather information. So I think some of the key aspects that would help with success are, at least for school districts, because that's how the structure I'm talking through, but making sure you have leadership and your IT department on board, that you have their support. We had school district leadership really making decisions about whether or not virtual anything could or could not happen, because they wanted to make sure it could be impactful first. And then definitely making sure the IT departments were comfortable with, personally identifiable information, storage of video, just use of equipment, things like that. We also had a lot of questions about whether or not assessment tools were valid and reliable virtually. And so that was a piece we kind of had to dig into, and there wasn't a lot of information and guidance, especially specific to tools. Luckily, a lot of our school districts in North Carolina use a play-based assessment, which is a more authentic experience to begin with. And that particular author did put out some guidance on using that tool with virtual assessment. So that was really helpful to us, is having that direct guidance from the developer of the tool that we primarily use. Like you all said, access to technology, right? It was either the equipment or we also have very rural areas that did not have access to the internet. And so getting that in place was important. Thinking about what could be recorded and shared versus taken live was a consideration for our districts. And then the last piece really was staff comfort. So we were balancing that comfort with the, health crisis right alongside comfort with technology, and do I feel like this is a valid way for me to gather assessment data? Mostly for that one, once staff got into it, they realized how beneficial it was when virtual assessment was done well.
I think that to kind of piggyback, that buy-in from practitioners can be really challenging, even still, even though virtual assessment has been around. When newer people come into that role, there's not a lot of training out there. There's not a lot of resources. And, sometimes that lack of self-confidence in yourself may prevent you from being able to do that. And so building our own people up at the same time as helping support the EI programs or the school systems, and letting them know that it can be done and it can be done very well. Sometimes that's a little bit of a barrier.
So that knowledge and comfort. Go ahead, Becky.
I was going to say, and I think that's also true for like service coordinators as we present that information about the options. Because a lot of times oh no, he'll never sit in front of a computer for an hour. And we're like, good, because we really don't want him to do that. And so really having them gain the knowledge of how to explain that to families, what the benefits are, what the challenges can be. We really did a lot of training with the service coordinators on that as they're presenting those options. after COVID, of course. And when we went back to, hey, you could do it his way or you could do it that way. So I think that was a training component too.
It really highlights the beauty of authentic assessment and how that's a strength. We do have a question in the Q&A, and it's for Amanda. It's this person would be interested to hear more about how to assess a visually impaired child with a virtual assessment. So if you would like to share any information about that.
Sure. Since we're talking about that birth to 5 population, I'm going to stick my answer down on that age range. But really, we are doing checklists. We're doing authentic play-based assessments. We're doing observations when we're going into the home or into the childcare setting. And so we're doing all of that on the computer screen instead. And we will meet before we have that assessment time with parents or providers or whoever's going to be facilitating our assessment, kind of let them know what we're looking for and coach them on some things. And then during the assessment, we can say, hey, can you move the camera a little bit over here? Or can you try this? Or, oh, I saw that they might have looked towards this ball. Can you bring the ball a little bit closer and see if they have another reaction? And those are actually all things that I would do in person too, because when we're doing those play-based assessments and we have multiple people in the same space, usually one person is responsible for that direct interaction at that time. And other providers or specialists may say, hey, try this, kind of off to the side. And so it's exactly the same way that I would do it in person. I'm just on a computer screen.
Right. Thanks, Amanda. And sounds like the family or whoever's with the child has an integral role in facilitating that. Yes, thank you. All right. Let's see. Right, I thought something else popped in.
Sheresa, I think there was a question about what tool we use for that. Indiana uses the assessment evaluation programming system, the AEPS, for that. So every child that comes into our system has that tool completed. And so that's what we currently use for all our virtual ones too, initially.
All right, thank you for the questions. So if you don't want to add anything else right now about benefits and challenges, we'll move forward. Continue to add any questions that come up into the Q&A, and we'll answer them as we go. So INTECA has developed a resource related to benefits and challenges and what we learned throughout our project. And so I'm putting that in the chat as well. It's our benefits and challenges of using virtual assessment document. So if you want to access that, feel free. And now we are going to continue. Oh, yes, and there's the image of it. We're going to continue. It includes a lot of the things that our panelists already shared, but even more detail in some areas that we kind of weren't able to touch on today. But a lot of the benefits, and when we think about challenges, really focusing on solutions for those challenges and how to, kind of overcome them. All right, so we go to the next slide. We're going to continue on the framework and move to step 3, which is planning and implementation for virtual assessment. So before Kathy reviews step 3 in the framework, we're going to invite our panelists to share again. This time, we're going to focus on lessons learned about planning and preparing. So back to our panelists. What have you learned about preparing practitioners for virtual assessment, and what has been successful in preparing practitioners?
So in addition to being somebody who actually does the assessments, I have a team that I support as well. And I think one of the important things for us at AIS is we make sure that we are available to coach our people who are new to remote assessments. So we will coach them separately, or we'll do assessments with them, or we'll talk them through the assessment process and kind of help build them up and be there to support them until they get comfortable. And that usually takes 2 or 3. So they have a wider range of student or children that they've assessed. Then once we're actually in the thick of it and assessing, I encourage our teams to get together as the team for that child and talk about what we're all going to be assessing, whether some of us will be in person or some of us will be virtual, and talk about ways that we can not double up on things or what we need to look for, or what tools we all might use so that we are all on the same page going into the assessment. And then usually we recommend a recap at the end where we can get together and talk about the things that we noticed. If someone had a question, they can ask the other person what they might have seen and they can give a different perspective. And that's been really helpful in a lot of my assessments too.
Bring a lot of preparation before and then collaboration throughout and after. Thanks, Amanda. Back here, Dawn, would you like to add anything? Okay, go ahead.
Yeah, I can just add that similar to what Amanda said, although I would say that for us, since it was not necessarily the thing that they do all the time, was practicing for comfort, giving people the chance to kind of set up and see how it would look. So some of that, not quite coaching, but giving them the chance to kind of experience it a little bit. Really thinking about and planning ahead for the equipment that's needed. Is there any kind of tech support that's needed, right? Like we're all used to, if we do webinars, we have someone who's responsible for the chat and someone who's responsible for screen sharing. And so making sure that those duties are taken care of. Really being clear about when there's flexibility and when there isn't. So is there flexibility in the location or the type of facilitation that's happening, or is there not? Planning that ahead and letting people know how to make requests. So like Amanda was saying, if we're like, hey, I'd like to see this, like how is that going to happen during the assessment really makes people feel more comfortable. And so that's what we've heard from some of our school districts as they were sort of navigating this.
Yeah. Inspiration. Go ahead, Becky.
And I just think for us, it was kind of, the whole being thrown into the COVID thing, it was like really quick, and having to figure out what we were going to do and do it. But I think once that we got everybody comfortable with the equipment and how you're going to do these things and go for that, then I think it just kind of evolved itself a little bit. Again, the tech support, having somebody there to call and say, hey, I can't get this to go on. What's going on? I think also just being able to develop some, um, you know, cheat sheets, I guess, for families, like on what to expect and how to do it. We try to support our assessment team with, doing reminder calls, those types of things, reminder text. Hey, remember you have an appointment tomorrow at 10, so that they can be efficient with their time and just go from eval to eval. Without having to worry that they have to call somebody and check and try to figure out where they're at. So we've done some of those types of supportive things.
Okay, great. So information for the families and then checking in with them and making sure that they're ready and see if they have any questions. Anyone have anything else to add about preparing families or strategies that you've used to prepare families to be successful? No?
It's just
Okay.
all about communication and teamwork, really.
Yeah. Yeah. Okay.
And Sheresa, you said preparing families, right?
Yes.
Yeah. So one thing I think we learned, another kind of pleasant surprise, was that families were really often more open to virtual assessment than we would have thought or assumed, and more skilled at it than we would have thought or assumed. And so that was eye-opening for a lot of different reasons, right? Just kind of our professional assumptions to begin with, but also the fact that a lot of times families were much more interested and willing to be partners and less intimidated by the process. So really leaning into, to the extent possible, following the family's lead and really taking the opportunity to provide some clear information about the goal of the assessment and what we're looking for. And then, like I said, just leaning into the family as like a really valuable partner in this process, and that they have a lot to bring to the table in making that assessment happen.
I think to piggyback off of that, Dawn, I think that I know we're not talking about benefits, but I've seen so many families who've been able to share things that they wouldn't have been able to share, or take us to another room and show something that they might not have shown us before, and really show us how they are the experts in their own children and take that, and they feel empowered afterwards. And that's been really, really nice to see.
Becky, did you unmute to say more?
No, I was just
Okay.
gonna kind of say I agree with all of those things, that I think it's really it's a learning experience for families. But I think the fact that, they can then now get off and implement some of those strategies that even the assessment team has given them. A lot of times as a service coordinator, we'll go back and they're like, oh man, he's like doing this and that, and those people were wonderful. But it's almost an immediate feedback sometimes for families to be able to just try those strategies.
Thank you. And we did hear similar things about families feeling like they're more prepared for coaching models and being more involved in assessment and the process from the beginning. So thank you for sharing all of that. Any last words in that area? And Kathy, I know we didn't particularly have you prepared to ask any questions, but did you want to ask any follow-up for this? Okay.
Nothing for me.
All right. So we do have some questions in the chat. We'll keep monitoring those for question and answer for our later time. We'll go ahead and finish now going through the rest of the framework, and then we will take some more questions in our question and answer segment shortly. So now we will turn it to Kathy, who will share more about step 3 in the framework.
Thank you, Sheresa, and thank you to the three of you. You have just laid the groundwork so beautifully for what I'm about to say. So big question, is your state, district, local program ready to commit to what is needed for successful implementation of virtual assessment? Well, the question there may be, well, what is needed for successful implementation? And I think you just heard quite a bit about what is needed. Next slide, please. In the framework, I mentioned our areas. Here's what we have identified from our interviews, our literature search, and our other information gathering processes. The key ingredients. You need leadership that is committed to allocating the necessary fiscal and human resources. It's not an enormous lift, but if leadership is not committed to making this work, like so many other innovations, it's not going to work. And so what does leadership need to commit to? Leadership needs to commit to supporting practitioners. And I think you heard this theme. Part of it is buy-in, which is helping practitioners understand what virtual assessment is, that it is doable, that it does, in fact, and we heard this, you heard this, provide high quality information about what young children know and can do. And we did hear from practitioners when we were doing the interviews of people who were absolutely convinced that could not be the case. Practitioners need the access to the technology. They need to know how to use it, obviously. And then you heard this theme. During COVID, we threw professionals into virtual assessment and basically said, good luck, go do it. That is not the way to implement anything. Now we know it's not completely different. We assume, many of the good assessment practices, I think, as you heard, carry over. But there are some differences, little tweaks for how you do things. And you need to prepare your professionals for how to gather that information virtually. You heard about supports for families. Families do want to know, what is virtual assessment? What's it going to mean? And also how to participate meaningfully. So the practitioners need to prepare the families before the virtual assessment. You heard about tip sheets for what this is going to be, what you can expect, and how you can meaningfully participate. And then we've got the technology issues. Families need access to the technology. They need to know how to do very simple things like how to use the video conferencing platform. And then we've got this whole area of technology. It has to be available. It is technology. People need to know how to use it, and things don't go well sometimes. So they need to know how to troubleshoot. They need backup plans. So again, going back to leadership, you need to get your technology ducks in a row and your support for technology. And finally, there's the policies and procedures issue. To make sure, particularly around the privacy and confidentiality issues, where information is going to be collected, making sure families understand how information will be collected. If there is video recording, which we have heard is an extremely useful way to go back and look at what the child did. You don't just have to look at it in the moment, but if you've recorded the video conference, you can go back and study it again. But you need to be careful about where that information is, where it gets stored, how it gets handled. And also things like billing, the licensing requirement issues and what you can bill for, how you can bill for it. Again, program leadership needs to be fully informed about what policies apply and how they apply. All doable, all doable. Nothing here is impossible, but it just needs to be done. Okay, next slide. So now you are to our next step, which is the planning and implementation. And basically take what you've learned, use our resources, plan your virtual assessment implementation, and then do it. Next slide. We do want to say we have a couple resources that are also in the pipeline, very close to being posted, but not there yet. One is a short resource for families on what to expect during virtual assessment. Another is a tip sheet to help families prepare for a virtual assessment. And then finally, some guidance for practitioners on some of the things we just talked about and some of the very same things that you heard our panelists talk about in preparing practitioners. We do want to say, for any of you thinking about implementing, you can take our tip sheets and use them as is, or take the content and incorporate it into your own tip sheets, put your logos on it. It is meant to be used. And if the content is useful to you and you want it in a different format, take the content and use it by all means. And then we have the last step in the framework, next slide, and that's the evaluating. And it is important. We have not heard much yet about people evaluating virtual assessment, but in the spirit, notice that the steps between 3 and 4, you've got a little circle going on there. And that is the notion that you implement, you learn, you reflect, and then you improve your implementation. Next slide. We just have a couple questions for you. What is working well with your implementation? What is not working well? And how can we make virtual assessment more successful for practitioners and families? So that's our framework. That's the 5 components and the 4 steps. And with that, Sheresa, I'm going to turn it back to you.
All right, thanks, Kathy. So now you've heard from the INTECA project and what we've been doing. You've heard from our panelists, and we're opening it up for questions. And first, we'll start with the questions in the chat, in the Q&A section. Feel free to continue adding. So let's see what we have here. So the first question is about, what are some of your go-to authentic assessments for communication for birth to 5 that you have found virtually successful? So what are authentic assessments for birth to 5 that you can use virtually? Do our panelists have any? I will say that as the INTECA project, we do not endorse any particular assessment tools, but we know that there's different policies and rules that states and programs might have. But do our panelists have any comments for that question? It's okay if you don't. I see head shakes of no. So we do not have an answer to that question. So that, I guess, is an area that needs more work, needs more information. So we cannot answer that. Kathy, do you have a response?
Yeah, Sheresa, I just put in the chat. On our INTECA website, we do have a resource, and this was developed by the Early Childhood Technical Assistance Center. And there were 2 resources actually developed during COVID. which are a list of assessment tools that lend themselves to remote assessment. Again, we don't endorse them. We didn't check it out. We haven't tried each of them. They've not been validated. But what they are, and you can kind of use the same criteria yourself, what they are is assessments that rely heavily on observation and rely heavily on parent report and don't involve a lot of scripted instructions with specific materials and timed responses. They're not direct testing. They're much more observation-based tools.
That relates to one of our last questions too about, so follow that link in the chat and there's some suggestions there. Our next question is, what bilingual and cultural adaptations are provided throughout the assessment process? And as we said earlier, you still need to have good assessment practices. In virtual assessment, you might need to do some tweaks. But do our panelists have any comments around bilingual or cultural adaptations that you have provided throughout the assessment process?
We use interpreters for, bilingual evaluations. And, they are on the virtual assessment with our other assessment team members in the family and do a lot of that interpreter work during the assessment. So we found that that has been a good amount of information that we can gather that way. And it's still very authentic and yeah, so that's what we do.
Thank
I
you,
have been in
Becky.
some situation. Oh, I'm sorry. I've been in some situations where we didn't have an interpreter for a few different reasons, and so we have used the translate feature within whatever conferencing software we're using, and it does work actually pretty well. And then I just have a cute story of one time I was doing an observation for a student who was dually enrolled. It's a bilingual school, and the only time that I could observe was during her Chinese only session, and I don't speak Mandarin. So I was able to use the translate feature on my computer in a way that I would not have been able to do when I was in person. And I actually got to understand what they were doing, which was really pretty cool.
So being virtual helped for that situation for you. Thanks. Thanks, Amanda.
And Sheresa, I can add, this isn't really guidance, but just a benefit was similar to what Amanda and Becky were sharing, but that the access to interpreters, especially in languages that might be harder to find interpreters for, is just better when you can do it virtually and it doesn't have to be someone local or nearby.
So access to more virtually, more languages. Yeah. Thanks, all of you. All right, we have another question, and it is, how do you get around using virtual assessment in rural areas where tech or internet is limited? So how do you get around that? I think Becky may have mentioned some around that, but would you like to add?
It's tough, because you just would think, oh, everybody has access to the internet. Well, they don't. We have done things where we have said, is there another family member that you can go to? We've sometimes worked with other partners like, oh, let's use the library where they have a room that we can use, or, maybe a community partner that they're involved with. Could we do it at the WIC office, after you've gone there and that type of thing. So I think it's just really trying to think outside the box a little bit.
I've also had some families who felt more comfortable sharing videos. And so we would communicate back and forth about what sort of things I wanted to see. And they would send me little 30-minute long videos. And that was what we could do in that instance.
Okay, thank you. Another strategy we heard was sometimes one staff person that does live nearby, depending on how the program is organized, might go in person while everyone else is virtual and bring the technology with them. Early on, like during COVID, we heard more about lending and mailing items, but we hadn't heard that as much toward the end. But that's another strategy.
We
Lending
sometimes
devices.
have had service coordinators that'll do that. Or even if the family isn't comfortable with that, the service coordinator will go, they'll get everything set up, they'll get it going, so that they can go ahead and participate virtually. So we do that for families.
So the service coordinator might set it up and then leave? Okay.
They will sometimes leave, or they'll use their device there, yeah. We do have the lending program that we've used, to where like if a family says, oh yeah, I could do that, but I don't have a device that's working right now, we can have a service coordinator take something out, show them how to get it working, and then go back and pick it up later.
Yeah. Let's see. I didn't see some of these questions in the chat. I guess they're mostly comments. Is there
Teresa,
one I
do
missed?
you see the one about eligible, not found eligible?
Okay, I'm just seeing that. Do you want to share it? I
Yeah.
didn't get a
If
chance to
children,
read
I
it.
think this is for our panelists, if children are evaluated through virtual assessment and not found eligible, are you hearing from parents they believe it wasn't a good assessment because it was virtual?
I have been in situations where that has been the case. Fortunately, those assessments were hybrid, where I had somebody in person or multiple people in person who could attest to the things that I saw virtually, and we had that collaboration before and after. I have had one situation where the family really thought it was not a good assessment, and so somebody else went out in person and did an assessment, and same result, but it just made the family feel more comfortable, and we wanted to make sure that they thought that what they were getting was reliable and valid.
Yeah.
I want to
Yes.
add to that too. One of the practitioners we interviewed told us about that there had been 8 instances of families the child not being found eligible where they asked for a reevaluation. And in all 8, the child was not. They did a reevaluation in person, and in all 8, the child was not found eligible.
All right. So we are getting close to the end of our time. Do maybe one of you might want to share. I don't know if you have anything to share about if like a state program or practitioner hasn't tried virtual assessment and might be considering it. What might you say? Any words of wisdom or advice?
I can say real quick, and it's really just reiterating what Kathy shared at the end there around really thinking about implementation planning, especially, now that we're not responding to a health crisis, really take the opportunity now to think about the, implementation planning and the kind of supports that can be lined up. And then the second thing I would say is just knowing that virtual assessment is an effective option. It doesn't have to be a one way or the other. It can be an option. And then there's the hybrid aspects that we've all talked about today. So there's just so much opportunity to be creative and really, as many of us have said, get more authentic assessments. And so I think it's an opportunity, but I would say really implementation planning, starting there. It's not starting with a crisis, but really starting with a plan.
I think too that the benefit to families, and that's who we work for, our families, because if we can get the assessment done more timely virtually, services start more timely for them, and that really is important, to get in there and get going. Obviously, we all believe in early intervention, so I think there is definitely a benefit for that. I think too that there is a cost effectiveness or a savings when you're not having to have contractors, drive for 2 hours to see a child. So, they're going to be more willing to step up, I think, and do more evaluations when they know that that piece of it is going to be much more effective for them.
All right, thank you. So just to kind of wrap up, I know we're at time, we're about a minute past. Thank you for joining us today. We will continue to post resources. We'd love for you to be notified. If you have not already, be sure to sign up for our listserv. It's at the bottom of the homepage of our website. You will receive an evaluation shortly for our webinar. Please give us some feedback. And we'd like to thank our panelists, Amanda, Becky, and Dawn, and our project officer, Rebecca, for joining us, and all of you. And thank you to our team behind the scenes, and Mallory, Scott, Jen Nguyen, and Keith Hebbeler for joining us and helping us. And thank you all for joining us today. So have a good rest of your day. And this is a QR code to our website. If you didn't already get to it, through all the links to our resources that we shared. Thank you.